Here's something that might shock you. Nearly every second adult in America is walking around with a silent killer coursing through their veins, and most don't even realize how much the game just changed. On August 14th, 2025, the American Heart Association and American College of Cardiology, together with a coalition of leading medical organizations, unveiled their latest blood pressure management guidelines. And let me tell you, this isn't just another routine update. This is a complete paradigm shift that could fundamentally alter how we approach cardiovascular health in America. With 46.7% of American adults currently battling high blood pressure, we're facing what experts call the most preventable cause of death on the planet. But here's where it gets controversial. These new guidelines are pushing for more aggressive early intervention than ever before, and not everyone in the medical community is on board. Why lifestyle changes alone might not be enough anymore. Traditionally, doctors have preached the gospel of lifestyle modifications first. And don't get me wrong, they're still absolutely crucial. We're talking about adopting heart-friendly eating patterns, slashing sodium intake, incorporating regular physical activity, and mastering stress management techniques. These foundations remain non-negotiable. But here's the part most people miss. The 2025 guidelines are advocating for swift medical intervention when lifestyle changes aren't cutting it. The reasoning? High blood pressure doesn't just threaten your heart and trigger strokes. It's now clearly linked to kidney dysfunction, type 2 diabetes development, cognitive decline, and yes, even dementia onset. Your brain is literally at stake in this battle. This raises a provocative question. Are we being too cautious by waiting for lifestyle changes to work, potentially allowing irreversible damage to occur? Meet Prevent, the game-changing risk calculator that's stirring debate. Enter Prevent, the revolutionary risk assessment tool that made its debut in 2023 and is now officially integrated into clinical practice. This isn't your grandfather's risk calculator. It evaluates both 10-year and 30-year cardiovascular risk by analyzing multiple factors including age, blood pressure readings, cholesterol levels. And here's the controversial part. Your zip code. That's right, where you live now factors into your health risk assessment, acknowledging social determinants of health. Some critics argue this could lead to healthcare discrimination, while proponents say it's about timely recognized that your neighborhood's walkability, air quality, and food access directly impact your cardiovascular destiny. Advanced testing. Going deeper than ever before. The diagnostic approach has become significantly more sophisticated. Every person with hypertension now receives a urine albumin to creatinine ratio test as standard protocol. No exceptions, no optional status. This test reveals early kidney damage that traditional blood work might miss entirely. Additionally, the aldosterone to renin ratio test, previously reserved for specific cases, now applies to broader patient populations, particularly those dealing with sleep apnea or stage 2 hypertension. This test identifies primary aldosteronism, a hormone-driven form of high blood pressure that affects up to 10% of hypertensive patients but often goes undiagnosed for years. The brain connection that changes everything. Here's something that might fundamentally shift your perspective. Your blood pressure isn't just a cardiovascular issue anymore. It's a neurological emergency waiting to happen. Even modest blood pressure elevations can gradually erode memory function and cognitive abilities over time. This revelation has driven the guidelines to establish a systolic blood pressure target below 130 millimeters Hg, specifically to safeguard brain health. But this raises another controversial point. Are we medicalizing normal aging processes, or finally taking brain preservation seriously? Personalized medication. One size definitely doesn't fit all. The cookie-cutter approach to blood pressure medication is officially dead. For adults managing multiple conditions like type 2 diabetes, obesity, or chronic kidney disease, single drug therapy rarely provides adequate control. The updated protocols recommend initiating treatment with proven drug categories: ACE inhibitors, ARBs, angiotensin receptor blockers, calcium channel blockers, or thiazide diuretics. For individuals with stage 2 hypertension, readings of 140/90 mm Hg or higher. Combination pills containing 2 medications are often the preferred starting point. And this is the part most people miss. For patients struggling with obesity, incorporating newer GLP-1 medications, yes, the same drugs making headlines for weight loss, may provide additional cardiovascular benefits. This intersection of weight management and blood pressure control represents uncharted territory that's generating intense medical debate. Pregnancy, where stakes couldn't be higher. Hypertension during pregnancy transforms from a manageable condition to a potential life-threatening emergency, with complications including preeclampsia and premature delivery threatening both mother and child. The enhanced guidelines now recommend low-dose aspirin, 81 milligrams daily, for select pregnant women, establish stricter blood pressure control targets during pregnancy, maintaining the 140/90 mm mercury threshold, and emphasize extended postpartum monitoring since elevated blood pressure frequently persists after childbirth. This approach has sparked debate among obstetricians about balancing aggressive treatment against potential medication risks during pregnancy. Your personal action blueprint, the lifestyle essentials that actually work, sodium management. Maintain daily intake below 2,300 milligrams, with an ideal target closer to 1,500 milligrams. Here's the reality check. Packaged foods and restaurant meals are your primary enemies, not the salt shaker on your dinner table. Alcohol strategy. Complete avoidance is optimal, but if elimination isn't realistic, limit consumption to 2 drinks daily for men and 1 for women. Stress mastery. You don't need to eliminate stress entirely. Impossible anyway, but you must develop management techniques. Whether through regular exercise, meditation practices, controlled breathing exercises, or yoga sessions, find your personal stress relief method. Weight management. Even a modest 5% body weight reduction can produce significant blood pressure improvements. Dietary approach. Embrace the DASH. Dietary approaches to stop hypertension eating pattern, emphasizing fruits, vegetables, whole grains, nuts, seeds, lean proteins, low-fat dairy products, and healthy oils. Physical activity. Commit to 75 to 150 minutes of weekly cardiovascular exercise and strength training. This isn't negotiable. It's medicine. Home monitoring revolution. Beyond clinic readings. Here's where traditional healthcare gets turned upside down. Clinic blood pressure readings alone are no longer sufficient for optimal management. Home monitoring has evolved from helpful to absolutely essential. Regular home measurements provide your healthcare provider with comprehensive data patterns that single office visits simply cannot capture. This information enables truly personalized treatment adjustments and reveals white coat hypertension or masked hypertension that office readings might miss entirely. Daniel W. Jones, MD, the Guideline Writing Committee Chair and Dean Emeritus at the University of Mississippi School of Medicine, emphasizes this paradigm shift. High blood pressure represents the most prevalent and modifiable risk factor for cardiovascular disease. By addressing individual risk factors earlier and providing more personalized strategies throughout the lifespan, the 2025 guideline empowers clinicians to help more patients successfully manage their blood pressure and reduce the devastating impact of heart disease, kidney disease, type 2 diabetes, and dementia. The collaborative effort behind these guidelines involved 12 major healthcare organizations, including the American Academy of Physician Associates, American Association of Nurse Practitioners, the American College of Clinical Pharmacy, American College of Preventive Medicine, American Geriatric Society, American Medical Association, American Society of Preventive Cardiology, Association of Black Cardiologists, National Medical Association, Preventive Cardiovascular Nurses Association, and Society of General Internal Medicine. The bottom line, more than numbers on a monitor. Ultimately, the 2025 blood pressure guidelines represent far more than clinical recommendations. They constitute a comprehensive roadmap for extending both lifespan and health span. Managing blood pressure effectively means protecting your heart, preserving kidney function, and safeguarding cognitive abilities for decades to come. But here's where I want your honest opinion. Do you think we're finally taking blood pressure seriously enough? Or are these guidelines pushing medical intervention too aggressively? Should we be more patient with lifestyle changes? Or is early pharmaceutical intervention the responsible approach given what we now know about long-term consequences? And here's the controversial question that's dividing medical professionals. If your zip code now influences your treatment plan, are we advancing personalized medicine or introducing healthcare inequality? Share your thoughts. Are these guidelines a revolutionary step forward or a concerning shift toward over-medicalization?